Thanks for being here on the Valder Beebe Show as I wrap up my morning with Dr. Stephanie Copeland. She's a Senior Medical Director at WellMed. Welcome, Dr. Copeland.
Thank you so much for having me, Valder.
You know, each year the Centers for Medicare and Medicaid Services, they conduct a survey to help healthcare providers find ways to improve their services and offer better care. So let's discuss that. What types of questions are in the survey, and how can they contribute to someone receiving better health care?
Well, Medicare is really interested in measuring the quality of care of how a patient can access their doctor. So they ask things like, when you needed an urgent care quickly, how quickly could you get care when you needed it? Or when you needed a routine checkup or routine follow-up, how quickly could you get those visits when you needed it? So Medicare is really focused on that access to care because, right, if you can't access your doctor, it's really hard to have your best health.
That's very, very true. Speaking of Medicare, are more doctors opting into this service? Because I remember at one time you would call a doctor and they didn't take Medicare.
Yes, so our WellMed and USMD clinics are always open to Medicare. We love our seniors and we're here to help them. I would say there are many doctors out there that are excited to be partners in senior care, so for sure.
What advice do you give patients from your perspective of WellMed who need care very quickly?
Well, certainly at our WellMed and USMD clinics, if we think a patient's having a life-threatening emergency, we always, of course, say call 911. If you're not in that situation, though, we have a motto called Call Us First. And we want to be partners with our patients. We want our patients to call us whether it's 2 in the afternoon or 2 in the morning. We're available 24/7 with folks who can take those calls and those concerns, both in person and virtual options, again, depending on the time of day, certainly. But that is something we're very passionate about, in addition to encouraging patients to have those routine preventative visits. And again, we definitely recommend those, and we try to provide them at a time that works for our patients.
What we're seeing now is insurance providers, they're giving incentives for us to get our routine screenings and make our routine visits to the doctor. Is this something you think is going to happen industry-wide?
It is a very common practice. And in fact, for many of our patients at WellMed and USMD, especially in our Medicare Advantage patients, there are numerous opportunities for patients to get incentives for things like colon cancer screenings or getting those checkups. So definitely check with your health insurance, because those are definitely very popular options that they offer. And it can help cover that expensive gas cost, right, to make that trip over to the doctor.
That gas is really something else. Okay, so
Sure.
Navigating healthcare, for us as the patient can be pretty overwhelming. How can we best receive coordinated care that we need?
Well, again, I think establishing a relationship with your primary care doctor is key, especially if you have other doctors or other care providers involved in your care. If you had a cardiologist, like a heart specialist, or a rheumatologist who helps with arthritis, each of them may have their own plan of care. And so you need that primary care doctor, and you need to sit down and visit with them regularly so that you can go over every single specialist, every piece of advice all those doctors have given you, and have someone to help support you through. It's also great to set an appointment and tell your primary care doctor that you need extra time so that you can get that when you need it. And also, don't forget to write your questions down. I always take 2 copies of questions. I give one to the medical assistant so the doctor can prep in advance of coming in the room, and one for me so I don't forget, because even doctors forget their questions.
So perfectly right. I really like that, Dr. Copeland. Where can we go for more information and inspiration?
Yes, to learn more, you can go to wellmedhealthcare.com/bettercare or cms.gov.
Dr. Copeland, I want to thank you for stopping by. My audience is made up of 89.9% baby boomer women, and I'm sure you're hitting the right note with them. Thank you very much.
Thanks for having me.
Hi, I'm Valder Beebe. I broadcast on radio, streaming TV, podcast, and in print publications. I interview the world's most fascinating authors, all because I love a good book. This summer, I partnered with WPS for BB's Summer Book Giveaway. We're giving away New York Times bestsellers and award-winning books. Books that inspire me, and I'm sure they'll inspire you. To be eligible to win a copy of Jesus Can Give You a New Life, answer this question. What is God's greatest gift to mankind? You'll find the answer in John 3:16 of the Bible. Send your response to the email at the bottom of the screen. I'm Valder Beebe, and I'll see you for the next BB Summer Book Giveaway.